Hello, as he said, I'm Eric Levey. I'm a pediatrician. I work at Kennedy Krieger. I feel like I have a bit of experience in working with transitioning youth, mainly individuals with spina bifida, cerebral palsy, autism, mental retardation, not so much the rare neuroimmunologic disorders, but I think a lot of the principles that we think of in terms of any child with a chronic condition apply because we're really talking about systems problems and not necessarily medical problems. I'd like to really thank the organizers, especially Doug Kerr, for inviting me today because I think this is a very important topic, and one especially that the American Academy of Pediatrics feels very strongly about, the Maternal Child Health Bureau feels strongly about, but we're really having trouble getting the message out to the masses, both parents and physicians. And so if you can stress the importance of this with your providers. Now, can I get a show of hands, just who in the room is a parent or a person with a disability? Okay, and who's a clinician? Okay, so a few clinicians out there. So I just want to point out there's really not very much research or science to transition. It's mostly personal experience, and there's a bit of descriptive stuff out there, but it's certainly not scientific. Also, the slides I'm going to show you are not in your handout. If you want copies of my slides, I can email them to you. My email address is right there if you email me. Nothing in here is rocket science, so don't feel like you have to write down everything, and I'm going to repeat myself multiple times. So hopefully by the end you'll understand it without having to write down too much. What I did put in there, which I think is the most important thing, is a list of resources and websites, and it's really my top 10 or 12 or something like that of websites having to do with adolescent transition, and they have tons of information on these websites. I picked the best of the best so you don't have to spend your time surfing the net to find stuff. With that, I guess I'll move on. So adolescent transition, what is it? We also call it transition to adulthood. Adolescents transition through multiple systems as they move towards adulthood, and we expect that as they get older, they're going to take on increasing levels of independence, and that includes in family, school, moving towards employment, social services, healthcare services, community recreation, etc. What does the word transition mean? Well, from the dictionary, it means the passing from one place, period, state, subject, or the like to another. But you have to remember the most important thing is that a transition is a process, not an event. You don't transition on your 18th birthday. You transition from over a period of years to adulthood. You mature. And transitions occur throughout the lifespan. You transition from the womb to extrauterine life. You transition from early intervention to school-age programs. You transition from elementary school to secondary school and then on to possibly work. If your parents get divorced, you may transition from a two-parent household to a one-parent household. There's lots of transitions in life, and all those transitions are important times to include healthcare providers, because that can be a time of emotional stress, but also healthcare problems come up, and you want to make sure that you're plugged in, especially if you have a chronic condition. And I think an important message is that transition means different things to different people and for different people. And what I mean by that is, if I talk to one person about adolescent transition, they may define it a certain way, and I talk to somebody else and they define it differently. And it's because who they're thinking about. If you're thinking about a child with profound mental retardation, it's very different than thinking about a child with transverse myelitis with no cognitive impairment. And so the visions of what you're talking about may be very different, although some of the principles will still apply to both. Some people would say adolescent transition, especially at age 18, is more like falling off the cliff. And that's because the service delivery system changes around 18 and 21. If you graduate high school at age 18, you may lose all of your supports, your peer supports, your social supports, the services of the school system. People in wheelchairs often have a hard time getting around in the community, and it was much easier to be with their peers when they were going to school. Also, insurance often changes at 18. You may get SSI redetermination. There's lots of things that change, and sometimes it's a sudden change, and we need to prepare. And the key word there is prepare for it. So what does the government have to do with transition? Well, I would say these are the key players at the federal level. In the Department of Education, you have the Office of Special Education and Rehabilitation Services, and within that, you have NIDR, and I can't remember what it stands for, but it's basically disability research. I think it may be the National Institute for Developmental Disability Research or something like that. But they've done quite a bit of research, or tried to, in the area of transition, mostly related to education. Within the U.S. Department of Labor, there's the Office of Disability Employment Policy, or ODEP. Within the Department of Health and Human Services, there's an Office of Disability headed by Peg Giannini, who's a former pediatrician. Maternal Child Health Bureau, especially the Division of Services for Children with Special Health Care Needs, formerly run by Merle McPherson and now by Bonnie Strickland. Done a lot of work. And the Healthy and Ready to Work National Center, which is their flagship on transition. It's really about staying healthy in order to work, and that's the hook. It's not about you need to see a new doctor. It's about how are you going to keep yourself healthy? How are you going to keep your insurance? How are you going to make sure you have your medications so that you can do the things that you want to do? Get married, go to school, go to work, those kinds of things. And that's what that's about. It's all Healthy and Ready to Work. One of the co-directors is a parent of a person with Wernig-Hoffman syndrome who grew up to be an adult and has tremendous experience, and she speaks all over the country. Her name's Patty Hackett. And they really they're in touch with the needs of people with chronic conditions, and that website is listed in your handout, so you don't need to worry about it. But Healthy and Ready to Work National Center, or HRTW. Also, CDC, through the National Center on Birth Defects and Developmental Disabilities, has shown some interest in transition and has worked with the AAP on some things. And believe it or not, the Social Security Administration is the 900-pound gorilla in the room, because although you don't think of them as serving people with disabilities, because of SSDI and SSI, which are millions and millions of dollars, they're very interested in transition, because for every person they can keep off the rolls of disability, that's money saved. And so they're very interested in putting money into programs that can get people employed and into the workforce. And I just was actually at the Social Security Advisory Board meeting earlier this week where they were speaking about just this. So the educational system has been thinking about transition for a long time. In 1997, they mandated that the IEP include transition, to think about it by age 14 and to plan for it by age 16. But we need to now more systematically think about healthcare transition and how do we take care of the transition to healthcare providers, making sure people have health insurance, making sure those things are taken care of. So I'm going to skip through this, I think, because I have a lot of stuff and I'm never going to get to it all. But basically, this defines, there's a new idea, 2004, which now says you have to think about transition starting at age 16, but it's much more results-oriented, which I think is good. It focuses on outcomes, and it says that you need to think about the child's needs and what they want. And it also promotes community experiences, which I think can be very important for building skills. So this just talks more about what IDEA says, and you can certainly get a lot more information about this from the National Center on Transition in Secondary Education. But I think the key to understanding unfunded government mandates is that we live in the real world and not the ideal world. Meaning, even though that federal legislation is there, does it mean every kid gets everything that they want and everything that they need? No. It means you have to still fight for it. It means that youth need advocates. They need parents and other people who are going to try and make sure they get what they need and who know what resources are out there. Because I can tell you, the transition coordinators in the school systems, many of them are good, but many of them aren't good. Why should we focus on healthcare transition? Well, there's increasing numbers of youth with significant disabilities and complex medical conditions now living into adulthood. We're thinking a lot more for everyone about quality of life and not just quantity of life. And what's going to be rewarding is being successful in something. There's a significant lack of adult providers for many types of conditions. People who don't have enough training to take care of these childhood onset conditions. Many young adults, it's been shown, have limited access to health care due to lack of insurance or lack of appropriate adult health care providers. And it's been shown that many youth don't receive all the preventive services, immunizations, prostate exams, whatever, breast exams, pap smears, pelvic exam, all those kinds of things that any ordinary person ought to have. People with disabilities have them less often because they see their specialists and they don't go for preventive care. Adults, in developmental disabilities, children are born with these conditions. We talk to the parents, and then all of a sudden the child's an adult, and they don't know anything about their own condition. They've never had to do it, and it's everyone's fault. It's not my fault alone. It's not the parents' fault alone, but we just forgot. So we need to make a more systematic, concrete effort to educate children as they get older about their own condition and to include them in decisions, to have them be responsible for their own care before they have to do it on their own. And so the bottom point is something we haven't really proven, but is the main reason behind transition, is that we think if we don't do a good job with transition, we're going to have poorer health outcomes for our youth with disabilities. But nobody's really proven that. But, it's sort of a no-brainer. I don't know that we have to prove it in order to say it's worth spending some money on it. So the Maternal and Child Health Bureau had some Healthy People 2010 goals, which have now been incorporated into the New Freedom Initiative of President Bush, and this is performance measure number 6 for children with special health care needs, and it's that all youth with special health care needs will receive the services necessary to make appropriate transitions to all aspects of adult life, including adult health care, work, and independence. Well, this is the ideal world. So what are children with special health care needs, for those of you who haven't heard this term before? It's a commonly used term in pediatric literature. But what it means is those children who have or are at increased risk for chronic physical, developmental, behavioral, emotional conditions and also require health and related services of a type or amount beyond that required by children generally. Well, that's a lot of kids, so it's like 13 to 18% of all children. Most of them have milder conditions, but they're still considered children with... So if you just look at children on SSI, it's about 1% of all children. If you take children who are technology dependent, that is gastrostomy tube, trach, things like something that we would consider technology, it's about 0.1%. So what are the problems? Well, there's been one survey that shows that only about 15% of children through a national survey met the MCHB core outcome, as previously stated. Only half reported having any discussion of changing healthcare needs as they grew into adolescence towards adulthood. So that's really discouraging. And for Hispanics, where the language barrier is probably the main reason, they were 40% less likely to have those discussions. So the American Academy of Pediatrics, along with the American Academy of Family Physicians and American College of Physicians, had a consensus conference in 2001 and published their findings in 2002. I was sort of fortunate to be part of that. But they define transition in healthcare as the purposeful, planned movement of adolescents and young adults with chronic illness, disability, from child-centered to adult-oriented systems, including health, occupation, and residence. And the goals that we came up with were 6. That every child, youth, ought to have an identified healthcare provider, and we were mainly talking primary care provider, although I think you could probably divide that and say you need a primary specialist and you need a primary care provider. And you need to have a medical home. The healthcare providers involved need to have a core knowledge and skills And transition and thinking about transition should be a required part of their training. And we think that everyone should have a written health transition plan by age 14 when we did that to mimic the IEP. So now you could say, well, by age 16. But the important point is to start thinking early and to discuss it and write down the important goals. And it doesn't have to be 20 pages. It could be a paragraph that says, these are the goals. This is what we think is going to happen. The child's going to go on SSI at age 18. They're going to get Medicaid. They're going to transition to a new PCP at age 21. They're going to have a new neurologist at age 21 or whatever that plan's going to be. But just so you've talked about it. So it's not a surprise. Oh, you know, I only see patients up to age 18. You can't see me till age 21. A continuously current medical summary. The idea of that is becoming very popular in many areas, that you could have a little smart card that you carry around and anybody could pull up your medical history. Well, in the meantime, until that's available, pieces of paper are pretty good too. And we think that, you know, to have a 2 or 3 page summary that has all your past medical problems, your medications, your allergies, your surgeries, your current healthcare providers, your typical baseline status, because if you show up in an emergency room with nobody to explain things about you, just having a description of what you're usually like can be very helpful. And it can be extremely important when you show up in a new doctor's office, because they don't want to look through a stack of records that's 21 years worth of records, because you don't have time to do that in a busy practice. You want to look through a summary. And you know what? As a physician, I'm not going to do the summary. We anticipated that if we could get funding, that is reimbursement to physicians, they might be willing to do it. But until that time, I think it's in the hands of the parents and the youth. And you know what? That's a great time to discuss that past medical history with that youth who's becoming an adult. So they actually know it. And we've started doing that in our spina bifida clinic. And it's amazing. People don't even know how they were born. You know, I was born by C-section? No way. I only weighed 5 pounds? No way. So, you know, people learn a lot about themselves discussing their history, and I think that's very important. So the 2 primary goals that I see for healthcare providers are, 1, transition to adult-oriented healthcare services, but also in a much broader sense, transition to adulthood. And that means all aspects of life. And there are ways that we can help, and you've heard about a lot of them already. Rehab, bowel and bladder continence, working on things that are going to make the person more functional as an adult. Neuropsychological examinations. We try to get every one of our patients to have a neuropsych eval before they graduate high school, so they have some self of their own limits and their own strengths. And it's about strengths and weaknesses, not just disability, but ability. This is sort of broken down into objectives. I've mentioned most of these things already. The transfer of care is the end result of transition. It's not the transition. And too many people focus on the transfer of care and not enough on the preparation that goes into it. So this is a diagram I stole from somebody else because I can't do PowerPoint very well. But basically, it shows you that transfer of care occurs at a single point in time, but the transition began long before. So important healthcare considerations, health insurance, decision-making. Does this person have the capacity to make their own decisions? And what are the options for making sure that somebody can make decisions for them? I can't explain them all now. I know a lot about them, but we don't have enough time. Are they certificate track or are they diploma track? Because that means they may stay in the public school system till age 21 or only till age 18, and you need to know the age of exit. If you're certificate track, it's a lot easier to get vocational training, whereas if you're academic, diploma track, you have to focus on the academics. Is this person headed for post-secondary education or a job right away? What skills do they need to have in order to get a job? What income will they need? What do you need to form a special needs trust to make sure they're taken care of as an adult? What about inheritance? What about SSI? Where are they going to live? Eventually, are they going to need a residential placement? What supports are they going to need in that residential? Do they want to live independently? Transportation, huge issue when you leave high school. Recreation, another one we often forget. So this is basically a summary of everything that I've learned about successful transition in the last 10 years. Start early. Most people say at the time of diagnosis is when people should be thinking about what's in the future. Focus on abilities, not disabilities. What abilities does this person have that you can use in the future to help them have a job? Find opportunities for success. People develop self-esteem based on repeated success in something. So you don't want to set somebody up for failure. You want to ensure that they have some successes throughout their lifetime and build on those successes. Develop a sense of responsibility as early as possible. That means helping around the house. I can't tell you how many parents feel sorry for their child with a disability and they don't make them do any chores. Well, it's been shown that kids who do more chores, and these are kids with disabilities, have a better outcome later on in life than children who don't have chores. And you can think about it, well, they learned how to do stuff for themselves. I can't tell you the number of adults with spina bifida who never cooked, cleaned, did laundry, and they thought they were going to live on their own independently when they turned 21. And some of them tried it, and they failed miserably and moved back home because they didn't know how to do anything. The home is the best lab for learning how to do stuff, okay? Envision a future. Have realistic expectations. Set goals. Identify needed supports and locate resources. Don't let somebody else do all the resource location because they may not know about everything. You need to investigate these things yourselves to some extent. Find opportunities for skill building. It's not going to all occur through the school systems. It's not going to all occur through healthcare. There's a tremendous number of volunteer opportunities, summer camps, community work experiences, community college during high school, all sorts of things that can build skills that can lead to independent living, that can lead to jobs. Promote self-determination and self-advocacy early. People talk about having their kids call in their own prescriptions at age 10, having them talk to the doctor on their own at age 12, 13, answer questions, and then only turn to the parent if they don't know what they're talking about. I better hurry up here. So, and then the key is reassessing knowledge all along the way and building on the knowledge that the youth is gaining, skills, and reassessing the goals and adjusting the goals as you go. So the key to understanding the system for transition is there is no system. Not like infant or early intervention where it's a fairly organized process. We haven't really figured out transition yet at the adolescent level. So I'm going to skip this. But we put together a work group, and we came up with some things we thought we could work on at Kennedy Krieger. And we're not a primary care site. We do rehab and chronic conditions. But these were our primary goals: promoting understanding and development of skills, promoting understanding of the medical condition, treatments and healthcare services, promoting independence in daily living, reviewing the educational vocational goals just to make sure that the school system is on track with things, or that they're not missing something, and promoting psychosocial adjustment, because transition is a stressful time. I can't tell you the number of young adults, usually they've left high school, anxiety, depression, all these 20-somethings with disabilities are suffering from it in varying degrees because they've been removed from their peer group and linking to resources. I'm not going to go through each one, but there's a process of understanding. You can't just tell somebody everything at one visit. You have to build on knowledge over time, and this is sort of our hierarchy that we think people go through in terms of being able to act on their own. This is the WHO conceptual model of health and disability. You may have heard of this before, but basically it says you have some abnormalities of body functions and structures which lead to limitations on activities, which are really what we call disability, and that leads to restrictions and participation potentially, which we call handicap, used to call handicap, and the idea of treatment is to prevent participation restrictions. That's the real goal. It's not to improve body structure and function, because a lot of time we can't improve it. It may just be to compensate for that which is missing so you still can fully participate in life. And that's really what I see as the most important part of what we do. So preventing secondary conditions is important. I'm going to skip through some of this stuff. How much time? I didn't keep track. 5 minutes, okay. So these are some topics that we developed into a lecture series that was open to anyone at Kennedy Krieger, professionals, parents, youth. I can tell you, we've hardly had any youth who show up for these things. The parents show up, the professionals show up. Why? Because the youth, they don't think there's a problem. They think everything's going to be just fine. And, it's not until they get older that they realize that they missed some opportunities. So, I'm not saying they need to show up for all these things, but somebody needs to be looking out for them. So these are some of my other recommendations for families and working with healthcare providers. Discuss goals with your healthcare providers. Come in with your goals. Don't just wait for them to ask you a bunch of questions. Clarify the roles. Are you going to be the primary person? Up to what point? What are you going to do to help us during this period of time? You don't have to be so forceful, but you need to ask some questions. Who's going to do what? Facilitate communication. I think having stuff written down in a care notebook. I tell people, organize every specialty you see into a section in a binder. And, have your neurology section, your gastroenterology section, your pulmonary section, neurosurge, whatever it is. And put every document you collect in there. And then somebody, if they need something and they don't have the record, they can look at it. Come to visits prepared, help manage time, schedule longer visits if you know you have a lot to discuss with your provider. Involve them in transition planning. So it's important to think about, who do you want on the team? Is the team going to stay the same as you become an adult? Is it going to change? Do you need all those people who were involved as a child as when you become an adult? Which ones are the most necessary? A lot of times, as people become adults, the number of specialists involved dwindles because they don't, there's some people who are more peripheral and they sort of become PRN or as needed, and there's certain ones who become more primary, and you want to involve those primary people early on. What are the services that are going to be needed? And probably here the list is the most important. Identify the organizations or agencies that are going to be the most helpful. And the ones on the right side are probably going to be some of the ones you haven't necessarily heard of, but can be very helpful. The Social Security website has a lot of information. Every state has Centers for Independent Living, or CILs, and you have the website to reach your CILs in your own state on my handout. But everyone has this. They employ at least 50% of people with disabilities. They do travel training. They do benefits outreach. They do advocacy. They refer you to housing. They do all sorts of things. And most youth and parents don't know about it because nobody's told them. Parent information and training centers. Every state has one, at least one. And they do a lot in working with parents on IEPs, getting advocates in there to help you. And then I think the condition-specific organizations are becoming much more knowledgeable, aware about transition needs, and developing programs specific to that condition. CF has done a lot of work on transition. Spina bifida has done some work. The people in autism are thinking about it. But no matter what the condition is, I'll bet there's some condition-specific materials related. And the local organizations are the ones that are going to know the provider networks. Who's the best for my child to see with this particular problem? Ask other parents. They probably know more than most physicians do in terms of adult providers. I think the veteran parents are the ones you should be asking with children with the similar problems. So I mentioned these are the leaders sort of in terms of research and organization around transition in terms of which disabilities. And the key to understanding services for individuals with disabilities is if you know one state, you really just know one state, because the agencies have different names and do different things and have different regs in each state. But these are just the generic names. There's VR, or Vocational Rehabilitation Agency, in every state, and they ought to get involved with somebody with a disability at age 16. And if that doesn't happen, you can make that happen by asking for it. Any child with an IEP is eligible. Any child with SSI is eligible. MRDD stands for Mental Retardation Developmental Disabilities. Every state has an agency that does DD. They provide long-term supports for individuals with developmental disabilities for adults. The CILs I already mentioned. Protection and advocacy agencies, every state has one. And I have these websites that link to every state, so you don't have to figure out too much. But they look out for your rights. These are lawyers who you can go to if you need somebody to help you with your case or give you advice. As I mentioned, SSA, I'm not going to have time to go through Social Security benefits, but it's pretty important to understand the difference between SSI, SSDI, whether you're likely to be eligible or not. Definitely age 18, that person is independent of their parents. Parental income is not considered. So if they have no income and they're age 18 and they have a significant disability, then they're going to be eligible for SSI. And then in 37 out of 50 states, that makes them eligible for Medicaid. Oh, good. Ask her. So people are redetermined at age 18 because they go from childhood standards of disability to adult. And so 30% will lose their benefits on the first go-around. Also, there's asset limitations. You can't have more than $2,000 worth of assets and be on SSI, which is ridiculous, which I think is the thing that needs to be changed the most about the system. So these are the states in terms of what they do. I'm not going to mention work incentives, other than there are a lot of work incentives. They're extremely complicated. There's something called the Red Book. Get a copy of that. It explains all of them. A lot of school personnel, transition counselors, do not understand them. It's better if you try and learn it on your own, probably. And these are some screenshots of the website, which show a lot of benefits for people with disabilities, employment for people with disabilities. And they want you to work. So they're going to help you. There's my email address again. I can send you the slides.